Hey guys, it's Paul here again, and I just wanted to take a few minutes to give you guys some tips for your top surgery and just some things that I didn't know before my top surgery that helped me out a lot. So anyway, first of all, I chose Dr. Charles Garramone down in Florida, and I stayed pretty close to the hospital, so I recommend you guys do that. I was about 2 to 3 minutes from the hospital. I stayed at the Hampton Inn in Pembroke Pines, Florida, and it was 2 to 3 miles away from the hospital. I had mine done at Memorial West Hospital, so this place is very close to the Hampton Inn, so they're close proximity, so good thing. If you're having yours at Memorial West, I recommend it, the Hampton Inn. It was nice. I think it was maybe a 3-star. They had breakfast in the morning, which was helpful. I could just leave the room and walk over to get breakfast. It wasn't like a big buffet or anything, but it was, fairly decent, and they had a lot of good fresh fruit there that I liked a lot, and it was nice. The staff was friendly, and I would recommend staying there. The room was comfortable. It had a fridge, a microwave, which is helpful when, because you're not going to be able to really go round and about too much, so at first. So I recommend that place if you're having yours at Memorial West Hospital. Another good thing about that area is there's a Cracker Barrel within walking distance of the hotel. It's very close. I mean, it's right there, so you can get a home cooked meal, some vegetables. I liked that about that too, so just walk right over. It was great. Another thing is it's close to a lot of grocery stores and drug stores and eating places, and it was very convenient. So, very good place to stay. I would recommend definitely having somebody with you. There's going to be times that you're going to feel good, and then there's going to be times that you feel crappy. And it kind of comes and goes, and you will definitely need somebody with you to help you out. You're going to be sore. You may feel nauseous. You may vomit. Things like that. I recommend, that if you have trouble with anesthesia or pain medicine, with nausea and stuff, go ahead and get Dr. Garramone to get you some Zofran before you leave the hospital. Ask him to, go ahead and get that filled as soon as you can, so you don't have to call him on the phone later after your surgery. I don't think he likes, phone calls too much after your surgery unless it's a big emergency. And to a surgeon, emergency is bleeding, swelling, fever, things like that. Those would be the big reasons that they would, think that you'd call them. So I recommend you getting the Zofran on board, as soon as you can, even before your surgery. When you get your pain meds filled, have him get you some Zofran. That'll help with the nausea and possible vomiting. I have issues with Versed sometimes, so the first day when I got home, I vomited a little bit, and even with Zofran I vomited, but Versed really does a number on me. It may not affect you that way, but so I recommend you get the Zofran on board as soon as you can. Don't wait till after surgery. I mean, you can, but it's going to be more difficult if you wait till after your surgery. So get that on board. Another thing is bring some milk of magnesia, and I know it's unpleasant, but bring some enemas. I had a problem with constipation. I never get constipated, but I did with this, and I think the reason for it was that the binder that he puts you in, it's great for your chest. I'm not saying he's doing anything wrong. He's supposed to do that. But one thing that it does is it presses on your upper abdomen, and I think it slows down peristalsis in the GI tract. Peristalsis is the movement of the waste through your intestines. So, and food and nutrients, how it pushes through your GI tract. Well, I think this slows down the movement in your GI tract, which causes you to get bound up. That's just what I think. I think the binder really squeezes on that, so it's hard to go to the bathroom. Like I said, I never get constipated. It got so bad I had to use an enema, and then once it cleared, I was fine. So I recommend you getting a couple of those Fleet's enemas at least, and if you find that you're not going in a couple of days, just use it. It won't hurt. It'll clean things out. You'll feel better. But I had a lot of abdominal bloating and from just not being able to go to the bathroom, and so I definitely recommend that. And and try those. Instead of having to call Dr. Garramone, just try those out. Try the milk of magnesia first, and if that doesn't get any results, then try an enema. That should probably help out. Now, if you've tried those things and nothing's worked, then that would be a reason to probably contact him. So I recommend that. And I recommend you get lots of bandages, and this is mainly after he takes the bandages off of you. When you're at home, you need to get a lot of bandages for your grafts, and Tegaderm's really good. It keeps the water out pretty good. So I use Tegaderm. Just probably nobody knows about Tegaderm unless you work in a hospital, but I liked them because they're sort of like plastic sticker things, and they stick really well, and so I was using those. Those were good. Trying to think of what else. I recommend you do some shopping, do your grocery shopping and stuff the day before your surgery. Just get things in place, because you're not going to feel good, and you're probably not even going to feel like riding in the car a couple of days after. It was pretty rough, but it's manageable, but it's a little rough. But if you plan ahead and do these things, you're going to find that your post-op experience will be a whole lot easier. So I recommend those little bendy straws. Those are good to have, because you don't really want to raise your arms. And a lot of movies. Get a lot of movies to watch. That's always good, because you're going to be in the bed a little bit there. So another thing I recommend is, even when you don't feel like getting up and walking all the time, get up and walk. If you're in the hotel, walk down to the lobby. Walk around a little bit. This will help to prevent blood clots in your legs, which are very dangerous and can travel to your lungs, and then you get a PE, and then you've got big trouble. They will actually lodge in the blood vessels in your lungs, and that's life-threatening. So yeah, definitely recommend you walk around more than what you're going to feel like. Just walk around the hotel. You know, I did that and kept my circulation moving, and that'll prevent you from getting the blood clots. Definitely wear the compression socks. If you're driving down there in a car and it's a long distance, if it's more than 8 hours, I would recommend you wear your compression socks before your surgery on the way down there. That's what I did. And if you're as far away as I was, you know, you want to get out of the car, walk around. This is before your surgery. And make sure you're keeping that circulation moving. At night when you go to sleep, you know, you can take the compression socks off, and that should be fine. But yeah, that's all I can really think of. So if you guys have any questions about something I didn't cover, you know, let me know. Send me a question or a comment, and you know, I'll be glad to answer any questions that I can. Let me just remind you, I'm not a doctor. These are just some tips that helped me out, and so I just thought that I'd pass them along to you guys, because, you know, love you guys and I want to help you guys out, and so yeah. Yep, let me know if you have questions, and I will check you guys out later.